developing a vaccine in record time. It will be ready before the end of the year and maybe much sooner than that. They're very unhappy about that.
Earlier this week, the CEO of Pfizer announced the company vaccine could be available for distribution to Americans by the end of the year. Joining me now is pandemic expert. We're bringing back Dr. Dena Grayson. We've been talking about these vaccines back and forth, Dr. Grayson. There is a risk to rushing a vaccine, but I have to think that the people who are in charge of that type of thing aren't playing politics. Am I right?
Well, at least thus far, when it comes to the vaccine makers themselves, Eric, they have all gotten together and been very forceful, very publicly, that they will not release a vaccine unless it's proven safe and effective. So I think that's very good news for all of Americans. You know, I think there's very encouraging data. The data are very early, but there are large ongoing clinical trials of tens of thousands of people that are getting the vaccine. That, you know, once you look at tens of thousands of people, that should give us a very good idea of whether or not, number one, the vaccine is safe, and number two, of course, whether or not it's effective. So I actually do think at the end of the day, the scientific process will win.
Doc, we'll be going into a season where we have, competing flus and epidemics and pandemics. What do they call it? The twindemic coming. How do we navigate this as households?
Yeah, Eric, we are entering a challenging time, as we've discussed on your program for months, that we knew that flu season would be starting and that we would enter flu season with no coronavirus vaccine. So a couple of things here. First of all, even if everything goes really well with the coronavirus COVID-19 vaccines, the very best case scenario is that we would have a vaccine available late this year, but very limited supply that would go to healthcare workers and other high-risk populations. And CDC director earlier today said we wouldn't have be ready to even start vaccinating the broad population until mid next year. And that's the very best case scenario.
So docs, a lot of these symptoms mirror each other, COVID and the flu. So what's the recommendation to a parent who has, or a person who's coming down with symptoms, whether it's fever or nausea, whatever? I mean, you could feel like you have the flu, but now you may be exposed to coronavirus.
Well, Eric, you hit the nail on the head. The signs and symptoms of influenza illness, as well as COVID-19, are very overlapping and very similar. And based upon your sort of clinical, how you're feeling, you really can't tell. But there are a couple of things that we are already doing, and I know you do, which is wear a mask, and which decreases not only transmission of coronavirus, but also other respiratory pathogens, including influenza. And secondly, you can get a flu vaccination. So that is very effective in covering the strains of the flu that are circulating. So unless you have a reason not to, everyone should go out there and get a flu vaccination now so that you can decrease your risk of at least getting influenza while we await the coronavirus vaccine.
Yeah, I didn't think about that. We may actually have a better flu season because pretty much everyone's wearing a mask.
Yeah, that's actually been seen in the prior flu season, Eric, is that once people started wearing masks, we saw a reduction in the transmission of colds and flus because they're transmitted in a similar fashion.
All right, we're going to leave right there. Dr. Dena Grayson, always good to have you. See you again soon.
Thanks for having me, Eric.